this hospital treats about 10,000 stroke patients a day. So,
is that it?
Yeah, that's all,
God,
And
10,000 a day.
yeah. So
Jesus.
imagine any major hospital system you can think of, whether it's the Mayo Clinic, Columbia Presbyterian, etc. But imagine every bed, 99% of every patient is going to have some kind of stroke, Parkinson's, neurological disease. And I was fortunate to receive a scholarship where I could study directly under him and live in China, and also study with him when he treated regular patients too. But I was observing, just kind of the great thing was just observing the arcs of seeing that many patients having a similar disease and seeing and comparing how fast or slow that they can heal, and just to see which health acupuncture points would work. And then fortunately, because I have a pretty relatively successful business in Manhattan, I was able to take that knowledge back each year and basically use it and apply it in an American clinical setting, and just to see what was reproducible or not. Because if I couldn't reproduce it, I didn't find it useful. I mean, it might be useful there, but it's
Right.
not useful for me back in this country, right? So, and if I couldn't reproduce it in Manhattan, that gave me all the questions and my next assignment, which was find the floor, find the patient, and find the doctor, that can explain it to me so that I can get my technique right. So we've really fine-tuned it now to the point where even if someone had a stroke and they lost their voice, or if they had severe Parkinson's, they started to lose their voice, we can bring the voice back in about 1 to 2 sessions. Like if they were just completely mute like this, we could start hearing the lower octaves activate.
What was it like the first time you saw that? I mean, we hear about okay, we know in the West it's kind of generally accepted acupuncture will work for back pain. And maybe even people are thinking it's kind of placebo or whatever, or, multifaceted, whatever. What was it like for you when you first started seeing these cases? This is real stuff going on, right? These are people with strokes, right? So
yeah, these were people who lived in the hospital. They stayed there 30 days, 60 days, sometimes 3 months. And we would see some extreme cases that later, eventually, the longer you're there, it's common to see this, right? But patients that would have a gastro tube through their nostril that goes to their stomach because their whole esophagus and digestive tract just can't have the peristalsis to move food. Okay?
So how do they, I mean, without those tubes, then they're dead.
Right. Because that's how you feed them liquid nutrients and stuff. The amazing thing was you could put herbal formulas down through there too.
Just pour it in the beaker.
Yeah, that's
you just have a funnel.
What they did. Yeah, and it kind of looked like that. So, and what's interesting enough is we would get really organized and we would start counting how many sessions. Okay, from the first time we would meet the patient, and usually even for someone that had a nasal gastric tube, it took about 54 sessions, and then the tube actually came out because the person could start swallowing again. And these are hospitals that have everything we have here, but the first thing that every patient gets in these hospitals is acupuncture, and it's led by the acupuncture doctors. Even if they had a urologist on staff, they would work with the acupuncture doctors, and everyone really integratively respected each other too, and it was pretty amazing to see. So even though you and I were talking about the extremes of pollution and how debilitating it makes you feel, what got me through China was actually seeing cases like this and looking for the next one to see how and why it worked, and also it was like the light for me at the end of the tunnel, which was like, okay, this is real. And this is even being done in a very extreme polluted environment, right? And they're still able to get this result. So, in my mind, what if we had this at a really healthy environment, someplace that's sunny, that has better facilities, can integrate even further things from Europe and America, right?
Mm-hmm.
And then we still use acupuncture and herbs together, and so because even for me personally, like, do I want to go back to China right away? Not really. I'm still enjoying my body recovering.
Mm-hmm.
It's been over a year and a half. Um, so so some patients of mine that want to go to Tianjin, I just look how strong they are. If they're not really strong enough, I don't suggest exactly right now going to China
Mm-hmm.
because the environment itself could hurt you
You know
forever.
what? We got to do the medical
So
tourism. Get them out of New York too.
yeah, that's right. We're gonna find the right beach and the right sun. So and some kind of blue zone there. So yeah, so that's the beauty of it, and that's what was great. Like, see, in China, when you have someone that has an extreme stroke condition, that person can get like a room that actually has enough room for their family to sleep next to their
Mm-hmm.
loved one and stuff like that. And I would love to create something like that in a healthier, more like an environment that induces health and makes you want to move and everything. So
Mm-hmm.
because I think a lot of times in America, there's just no room. There's a curtain, and then that's it, you know. And also for these kind of patients, uh, they get checked out pretty immediately once they're stable. And I think a lot of the patients actually have to stay in the hospital a little longer. So a lot of times they get checked out in less than like 16 days or in 2 days, and what's happening is we're losing our time to observe the patient, to see how the stroke is affecting the patient. Um, and because of that, there's no clear plan yet in America where when this happens, you go to this person, you do this, you do A, B, and C.
Mm-hmm.
Every patient that I've met has had their own plan that they put together, no matter what background they're from. So it doesn't matter. So those are some things that we want to work on too. Is just making it um, making it more organized and accessible,
Mm-hmm.
and getting people to the right people. Many times I'm not the right person, but at least I know someone, like a great neurologist or a surgeon that you should go to, and the ones that I know, we work well together. We send each other notes, we talk about the patients, so it's happening right now. Like, there's a lot more openness and integration that's
Mm-hmm.
really coming across the whole country and stuff. So, yeah.
Very good. What was the most dramatic effect that you have seen with stroke or Parkinson's with regard to Chinese medicine?
Um, Dramatic or
Or traumatic, either one.
I mean, I've seen a patient that was in a coma, and they gave the acupuncture protocol to the patient every day, and that patient never lost any muscle mass, wasn't moving, okay, didn't shrink at all. It was pretty amazing, and the patient was there for like 3-4 years, So
Whoa. Yeah.
yeah. Whereas when you see
Yeah.
someone like Christopher Reeves, who had a neck injury,
Mm-hmm.
and he's using physical therapists to move his body and really complex machines just to have his body try to maintain itself. The amount of money he spent on that versus if you just got like 20 acupuncture needles in the right place.
Mm-hmm.
Do you know what I mean? Like, the cost effectiveness is amazing. So I always tell people, like, and one of my dreams is and this is why I'm teaching the method that I took from China and then combined with how I handle patients and treat patients in America, is basically the acupuncturists and herbalists. We really should be the immune system in healthcare that first attacks these diseases.
Mm-hmm.
You don't need to take a drug. You don't need a procedure. We have our methods of diagnosing and evaluating that actually we can now explain better, and in Western terminology to doctors.
Mm-hmm.
But we really should be on the first defense line which is why I kind of see us as the white blood cells of the healthcare system, So, um, so because a lot of times, and I'm sure this has happened to you, you get a patient that had a stroke 3 years ago. They've seen every single doctor. They've tried every single crazy method, and then they ask you, can acupuncture help? We should have been involved in the first 10 days.
Yeah, at that point we can do really dramatic things, but then after 3 years, I can make minimal changes at that point. I know you have some cooler techniques up your sleeve, but it's just much slower going at that point.
Yeah. So our method and the acupuncture, I call it the Nano Puncture system. Basically, we don't use scalp acupuncture necessarily. We use points that every acupuncturist knows, but we teach the research that's behind why you manipulate this needle for X amount of time. Why do you have to move the needle around a little bit? Okay. And then what we do is once we feel like we teach the acupuncturist how to guide themselves, the acupuncturist can go and do things that I can do. Like I love it when a lot of my close students who are acupuncturists that have been in practice for 10 years, 5 years, they'll call me and they'll say, okay, I just took someone off the surgical list that needed that nasal gastro tube because I already activated their esophagus and they can swallow water now. Or, this patient couldn't even move their big toe for about 4 years. And then after one session, their whole foot can start wiggling and, they're doing like little Pilates exercises and stuff like that.
Right. So, now, and to play devil's advocate for, those who are listening thinking, bullshit, how can this be affecting? Well, first of all, with you mentioned the man who had he was in a coma and he didn't have the muscular atrophy during that time. Well, there have been studies showing that the atrophy is signaled by having too much INOS, inductible nitric oxide, and acupuncture can help to regulate nitric oxide. And this is also a similar mechanism at work with the intestinal peristalsis. You need kind of a sweet spot of that, and as well for neurogenesis. So if the nerves are shut down or deactivated, it's often, I should say, one of the pathways involved is by way of gasotransmitters, which acupuncture, Chinese medicine, Qigong very directly influences. That's kind of the main pathway of it.
Yeah, and that's a great point, is even though you're hearing me when I mentioned stroke, and paralysis, it's not just paralysis of the limbs. The organs start to not function and they, in a sense, become paralyzed. So, and that's when those nitric oxide deficits start to happen. So a lot of times, and this happened recently, I had a patient who, before the stroke, she had this abdomen surgery where they had to take part of the digestive tract out, where it connects the stomach and the esophagus. Okay, so, and the doctor had stuffed he was a military doctor. He had stuffed the abdomen with this special sterile gauze, right? Just stuffed it out till the person's belly was like a balloon. It saved her life, right? But when they took it out, they just kind of like put a cap on it, and like the rest of the scar was like this hard plastic on the body. So I started treating the patient, and after the first visit, she was able to stand up and dance with her husband, and we all cried in the room. Wow. It was amazing. And then later, I just noticed the scar, and I asked them, do you mind if we treat the digestive tract more and the scar? Because I think it's inhibiting a lot of things, right? And I can tell you that because of that hardening of the skin outside, that the NO receptors and everything was way off. There was a lot of weird flora like growing in her digestive tract. And she would get this constant burning in the chest and throat. So I didn't have anything except magically the MicroGuard Plus. Right? And I took like 5 to 7 tablets and basically like fed it to her with my own hand. And they were so small that it was actually relatively easy for her to swallow, because she also aspirates stuff too. And then in about 10 minutes, the burning started to subside. It was really cool. So I told the person, I said, okay, we're going to start moxa and heating up and treating the scar tissue and the functions of these organs.
Mm-hmm.
By the second session of doing that, she was able to tell her husband when she had to go to the bathroom, or could feel that, like, you know, a bowel movement is coming. And she hasn't been able to say that for almost like 2 years.
Mm-hmm.
So it's pretty amazing that the acupuncture can definitely create neurogenesis, can reactivate the functions internally and externally of the nerves. And a lot of times what we do with the nanopuncture method is we reset these brachial plexus, right, the lumbral sacral plexus, so that the whole body just starts. It's like resetting the circuitry of the body, you know. So we could do that with the limbs, or in this case, we did it with the bladder. We started doing it with the stomach and the colon too.
Mm-hmm.
And because of that, the person is more, they can twist kind of more easily, like sit upright too, without assistance from their spouse. So it's pretty exciting that it's when you see that happen, because the spouse who's taking care of their loved one, they're probably throwing their back out, trying to lift them up, trying to carry them. And even the little changes that you get right in the beginning, you can have someone that's a hemiplegic type case, and they can still prop themselves up if you teach them a little bit of qigong, some core work, a little bit of Pilates and Tai Chi, and then, you know, and they can just almost move their body around like this and start to move. And it just makes everyone's lives and quality of life much more manageable. So, yeah, it's pretty amazing.
As a martial artist, how has the study of stroke and paralysis informed your practice, and what has it taught you about performance enhancement for those who don't have stroke? Because you're looking at people who are just breaking down, their nerves aren't firing. What has it taught you?
It's pretty amazing. So we're taught tons of things in Chinese medicine school, and also just with the body and movement. And, you know, we're taught many things like the extra vessels, the Du, the Ren channel, things like that there's not that much material on, right? So when someone has a stroke, it's like saying before there were, like, you know, 12 meridians, now there's 10. Okay? And now what are you going to do? How do you really use the acupuncture points to activate those 2 missing meridians? Do you know what I mean?
Mm-hmm.
And when someone has a severe condition like stroke, you can clearly see the deficit of what's missing. You can clearly see when it starts to come back and turn on, and it makes you appreciate your body better. What I do is I take some of these points and I'll use it to help someone prepare for a marathon. Mm-hmm. Or I'll use it to help someone increase their golf range, like by needling the shoulder and hips and the calf muscles. And all of a sudden their driving range goes up like 100 meters or 50 meters, you know. And they didn't even practice. They just could swing better because their body is more efficient. So, and we can definitely see that it increases sports performance tremendously too. So it's pretty amazing. So I call it the neural reboot. Sometimes your body needs like the neural reboot because it's just not functioning right and you can't tell. And then we'll put a couple of points in, and the special ones that I learned from Tianjin will feel a little bit like electricity coming through your arm for a split second. But then all of a sudden, maybe your arm is like 10 pounds stronger than it was 1 second ago, you know, and we can measure it too. So it's pretty interesting. So, yeah.
But that is awesome. So how can people contact you, especially if they're in the New York area?
Oh, they can contact me through my website. It's claytonshiu.com. And my email address is also clayton@claytonshiu.com as well. And, you know, shoot me an email, like send me your question and stuff. And if it's appropriate and I think we can help you, I'll definitely do my best to get you the assistance you need. And also for acupuncturists who want to learn how to treat stroke and like neurological conditions, including Parkinson's, and also some spinal cord injuries, we have the nanopunctureseminars.com website that's up now. So it has my teaching schedule across the country. And I'd like to emphasize that it's not just for stroke. Like the way we created these modules, it's almost like when you're learning an instrument like piano or your form. Like we're choosing what you should start to practice with your hands and your needles first to build your gong fu up and your level of like tactile skill. Mm-hmm. And then each module after that starts to get more and more complex. So it's pretty interesting. So, and a lot of our students find that it's kind of changed and retooled everything with all their patients, not just stroke patients as well. So, yeah. So I kind of put a lot of our Tai Chi and Gong Fu training into explaining the acupuncture techniques and advanced methods as well.
I used to carry every herbal formula I could get my hands on. You can just imagine how this clogged up shelf space and mental space, plus it gave me a lot to dust every week. We looked at our most effective products, our automatic top sellers, and found that they coincided with the most popular and effective herbal products in East Asia. We decided to focus on the winners and then make them even better. Our research team in Chengdu upgraded these formulas using the highest quality herbs on the planet and rigorously testing them at pharmaceutical standard for quality and safety. You'll want to get your hands on this, and you'll get your supplies at botanicalbiohacking.com. Thanks for listening to the Botanical Biohacking Podcast. I'm your host, Andrew Miles.